டாக்டர் ராமசுப்ரமணியன், இன்ஃபெக்ஷன் ஸ்பெஷலிஸ்ட்டாக இருக்கேன். கேப்ஸ்டோன் மல்டி-ஸ்பெஷாலிட்டி கிளினிக்னு டி நகரில் இப்போது திறந்திருக்கோம். இப்போது தடுப்பூசிங்கிறது எல்லாருமே குழந்தைகளுக்கு தான் அவசியம்னு நினைக்கிறாங்க. அது ரொம்ப தவறு. நம்மளுக்கு வயசாகும்போது எல்லாருக்குமே எதிர்ப்பு சக்தி கம்மியாகிட்டே வரும். எஸ்பெஷலி 50 வயசுக்கு மேலே ஆகும்போது இம்யூனோசெனசென்ஸ்ன்னு சொல்லுவோம். இந்த எதிர்ப்பு சக்தி பாடியில் இருக்கிற டிஃபென்ஸு வீக்காகிறதுனால சில விதமான இன்ஃபெக்ஷன்ஸ் நம்மளுக்கு கடுமையாக வரத்துக்கு வாய்ப்பு இருக்குது. ஹாஸ்பிட்டலைசேஷன் தேவைப்படலாம், சம்டைம்ஸ் உயிரிழக்க நேரிடலாம். இது நம்ம கோவிட் டயத்துலையும் பார்த்தோம். அதே மாதிரி ஒவ்வொரு வருஷமும் இன்ஃப்ளூயன்ஸான்னு வருது, ஃப்ளூ காய்ச்சல். அதில் கூட வயசாகும்போது நுரையீரலில் பாதிப்பு ஏற்பட்டு வைரல் நிமோனியா வந்ததுன்னா சிவியராக இருந்து உயிரிழக்க நேரிடலாம். ஸோ இந்த மாதிரி ப்ராப்ளமை தவிர்க்கிறதுக்கு எல்லாருக்குமே தடுப்பூசி அவசியம். 50 வயசுக்கு மேற்பட்டவர்களுக்கு சில விதமான, உதாரணத்துக்கு ஃப்ளூ, நிமோனியா ஊசி, அக்கி ஷிங்கிள்ஸ் அப்படிங்கிற ஒரு கண்டிஷனுக்கு ஒரு ஊசி அவசியம். அதே மாதிரி டெட்டனஸ் டிப்தீரியா பூஸ்டரும் போட்டுக்கிறது அவசியம். ஸோ நம்மளுடைய வயசுக்கு ஏற்ற மாதிரி நம்மளுடைய என்ன வேலை பண்ணுறோமோ, நம்மளுடைய ஹாபீஸை பொறுத்து, நம்மளுடைய சுகர், பிபி அந்த மாதிரி இருக்கிற கோமார்பிடிட்டிஸை பொறுத்து எல்லாருக்குமே எந்த விதமான வேக்சின் அவசியம்னு கண்டுபிடிச்சு அதை போட்டுக்கிறது ரொம்ப ரொம்ப முக்கியம். வேக்சின் எடுத்துக்கிறதுனால ஹெல்த்தியாக இருக்கலாம். கேப்ஸ்டோனில் இப்போ அந்த ட்ராவல் அண்ட் அடல்ட் வேக்சின் கிளினிக்னு ஆரம்பிச்சிருக்கோம். அது எல்லா விதமான நபர்களுக்கும் அவங்களுக்கு தேவைப்பட்ட வேக்சின்ஸை கொடுத்து ஹெல்த்தியாக வச்சுக்கிறது தான் எங்களுடைய நோக்கம். ஸோ தயவுசெய்து உங்களோட மருத்துவரை அணுகுங்க. உங்களுக்கு எந்த விதமான தடுப்பூசி தேவைங்கிறத தெரிஞ்சுக்கிட்டு அதை கண்டிப்பாக எடுத்துக்கிறது அவசியம். இது ஒரு எப்படி நம்ம ஹெல்த் இன்சூரன்ஸ், வெஹிக்கிள் இன்சூரன்ஸ் எடுத்துக்கிறோமோ அதே மாதிரி வேக்சின்ஸும் நம்மளுடைய உடம்பை ஹெல்த்தியாக வச்சுக்கிறதுக்கு ரொம்ப ரொம்ப அவசியம்.
ஏஜ் லிமிட் அண்ட் கோர்ஸ்
இல்லை, ஒவ்வொரு வேக்சினும் வெவ்வேறு விதமான ஷெட்யூல் ஒரு கோர்ஸ் இருக்குது. ஃப்ளூ ஊசி எவ்ரி இயர் ஒன்று போட்டுக்கணும். நம்ம தமிழ்நாட்டில் இருக்கீங்கன்னா யூஸ்வலி ஆகஸ்ட் செப்டம்பரில் போட்டுக்கிறது நல்லது. இப்போது நிமோனியாவுக்கு ஒரு ஊசி இருக்குது. 50 வயசுக்கு மேற்பட்டவர்களுக்கு ஒரு தடவை போட்டால் போகிறோம். அது மாதிரி ஷிங்கிள்ஸ், அக்கிக்கு போடுற ஊசி 2 ஊசி 2லேருந்து 6 மாதம் இடைவேளையில் 2 ஊசி போட்டால் போகிறோம். ஸோ அந்த மாதிரி ஒவ்வொரு இன்ஜெக்ஷனும் அது தனி முதல் கோர்ஸும் இருக்குது. அதுக்கு பூஸ்டர் தேவைப்பட்டதுன்னா, உதாரணத்துக்கு டெட்டனஸ் டிப்தீரியா பெர்டூசிஸ் பூஸ்டர் 10 வருஷத்துக்கு ஒரு தடவை போடணும். ஸோ அதுக்கு ஏற்ற மாதிரி ஒவ்வொன்றும் வெவ்வேறு கோர்ஸ் இருக்குது.
இது அதர் டாக்டர்ஸ் இன்ட்ரடியூஸ் பண்ணுறது தான் நீங்கள் வேக்சின் போடுங்களா, இல்லை உங்கள்கிட்ட கன்சல்ட் பண்ணி வேக்சின்?
இல்லை, யார் வேக்சினுக்கு வந்தாலும் இப்போ பேஷண்ட்டே எனக்கு ஃப்ளூ வேக்சின் எடுத்துக்கணும்னு சொன்னாங்கன்னா அவங்களுக்கு போட்டுருவோம். இது ப்ரிஸ்கிரிப்ஷன் தேவை இருக்கிறவங்கிறதுக்கு அவசியம் கிடையாது. மற்ற டாக்டர் ரெக்கமெண்ட் பண்ணாலும் போடுவோம். இங்கே நாங்கள் எங்களுக்கு என்ன வேக்சின் தேவைன்னு தெரிஞ்சுக்கிட்டு போனோம்னாலும் இங்கேயும் அதுக்கு கவுன்சிலிங்க்கு ஆட்கள் இருக்காங்க. அது உங்கள்கிட்ட பேசிட்டு போட்டுக்கலாம்.
First of all, hearty congratulations to Dr. Subramaniam, you and the entire team here for having made such a fantastic facility. It doesn't look like a hospital first. It doesn't look like something where medical care is present. It looks more like a kind of a nice 5-star place. Yeah. People would like to come and probably have a nice, not necessarily outing, but an atmosphere which is not very semblant of a very, what must I say, hospital setup is a different setup. It gives you a certain kind of a mental, stress, which is not there. So first of all, hearty congratulations for that, because not many facilities I've seen as medical facilities can match up to this. They say, as in the old adage, that prevention is better than cure. So it is very important that people realize that the most effective thing to do in life would be to prevent, rather than run after what has happened and then take steps afterwards. That way, vaccination, which was there as a very important part of childhood, childbirth, to all of us, not now, even before everybody has got those masks, vaccination was very important those days, even continues to be for children as it used to be. But not many were aware of the fact that adults also need vaccination for several ailments that can strike them or can befall them as they age. So as medical science advances, I think it is only prudent on our part to take advantage of the progress of the advancement in medical science. But I personally think 2 things are very important for somebody to be saved in life. One is prevention, one is timely attention in terms of medical attention. So, excuse me. People have had gone into difficult situations simply because medical attention was not immediately forthcoming or they didn't care about it. Or they took it a little easy, thinking that one, this may not be, or this cannot happen to me. This cannot happen to me syndrome is there with everybody, particularly people who are fairly able-bodied, who think they are quite strong, they are fit and all that. But illness can strike anybody anytime. It is not to scare people off, but the whole idea is only to make sure that we take necessary steps and then we are not suddenly surprised by any kind of illness which may strike. So that way, vaccination, as I have understood now, after interacting with this wonderful group here, is I think very, very essential. And I myself have gone through the vaccination process here, having been administered vaccines for shingles, for hepatitis, for flu, and probably some more which I can't even recall. Pneumonia as well. So I used to be always fairly scared that whether it will suit me. This is the same scare as was when the COVID vaccine came. People were, one is they were forced to take the vaccine, they had no other choice. But the scare was always there. Will it suit me? Will it have side effects? Will it be painful? Will it be this? Will it be that? So now I was not in any way different from them. I was asking all sort of questions. Basically with the shingles, they were trying to tell me that it's most important and then it won't be painful. The number of times I would have asked them the questions has pained them more than the pain I got from the shingles itself. So, then I was so convinced by the whole thing that I even told my people who were eligible to take it to kind of go through with this. The whole idea is not for anything else. It is like insurance. I personally think it is like insurance. As long as you are fully protected, it's fine. Right? Will it happen? I don't know. But if it happens, then you are protected. That's what I'm trying to say. So many people, even medical insurance has now come to stay to a great extent. But there are even many, probably even 5% of the population is covered by medical insurance, probably even lesser. Nobody cares about it. They think of it as a useless expense. But my point is, as long as it's a useless expense, it's good for you. Because the moment it has to be used, then you are in serious trouble. So we have to understand that like prevention of a disease, even prevention of a financial situation like insurance is very important. So just to repeat or just to underscore what I've said, I personally think that this is a fantastic initiative and then this has to be spread. People should know that this is very important and that they cannot be away from it. After all, in today's life and circumstance, I don't think it's extremely expensive or something. Because if you look at the pain that one has to go through, should it affect you, is a lot more than what you need to do to prevent it. So I would strongly enthuse people here and even people in the system here, people who have used it, people who have got to kind of spread the word that vaccination is most important. And it is not that you are doing it because you have come to a certain stage. But I think that as soon as you cross a certain threshold, as doctors will guide you suitably, I think it's a good thing to kind of go through it. And my personal experience was that it was completely painless, there was no after effects, there was no nothing, it was perfectly fine. So I want to thank Ram Subramanian and all his team who have made it easy for me, made it comfortable for me and also made me educated in the process that vaccination is very important. And I'm so glad that there is an institution dedicated to vaccination and to vaccines like how this is being. And this is not like any, as I told you, as I preamble my talk to you, this is not looking like any hospital situation. You just come here, enjoy yourself, have a shot and go back. And probably have a shot later also. I was just reminded of a friend of mine who was very scared of this COVID happened. And then he went to the hospital and he had his COVID shot taken. And he was always worried he's going to have some side effects. If you all understand Tamil also, I'll just delve into a little of Tamil and English also. So he, after meeting with the pro, he got a little scared. Then he calls the hospital and says, "Doctor, I don't know. I think I've got some side effects after the COVID vaccine. And I said, doctor, I'm not able to see." The hospital said, "Don't worry, your glasses are here. Come and take your glasses." I had a friend of mine in England who, they were Pfizer vaccines. They were being given there. And then he went and complained to the doctors. The doctor, "I don't know, after I had this vaccine, I am not able to, when I pee, there is no sound at all, there is no noise when I pee." Then he said, "Don't worry, when you take the Pfizer vaccine, the pee is silent always." I hope it was not upsetting the sensitivities of some people here, but this actually happened. So this is what it is. But jokes apart, I think it's a great effort. It's a great initiative. I want to again thank you so much that, this is a great service. More than anything else, this is a great service. I think medical profession itself is a great service. It's a great service to society. And then this particular thing which is not known, not very kind of advertised, not well understood, not properly educated into the market, people think of it still as some kind of wasteful thing. Vaccine now or biome or see, all these myths you have to bust. And this can happen only by ambassadors like you who are sitting here, who are going out in the market, who had the vaccines, who got the effects, who know what it is, what it means. Only you can go and tell the market what it is. Because I would think if you are not amenable to vaccination, you are vaccinating yourself against reason. If you don't take advantage of this great situation, you are vaccinating yourself against reason and intelligent living. Thank you.